So there are many very common causes of back pain. The most common being muscle strain or muscle spasm or ligamentous strain from athletic injury or heavy lifting. We look at the different parts of the spine to help try to identify what are the sources of pain for a patient, and we call them the pain generators. So typically, as we age, there's wear and tear to the spine, and there are many different sources of wear and tear that can cause pain for patients. For example, the discs in the front of the spine can degenerate. The discs are a common source of pain because the discs will dry up and degenerate over time. There are other sources of pain, very commonly including the joints in the back of the spine. The spine is a mobile part of our body, and the joints in the back of the spine help facilitate the movement. The joints can become arthritic just like any other joint in our body, such as shoulders, hips, knees. The actual ligaments around the spine can compensate for wear and tear and overgrow, and in doing so, the ligaments can also be a source of pain. Additionally, you have your big sacroiliac joints, which are here connecting your sacrum to the pelvis. These joints here are also a source of arthritic type pains for patients. Someone should see a doctor about back pain if they have sudden, sharp, severe back pain, or if they have back pain that persists or worsens over the course of, let's say, weeks or even months. Otherwise, if there are neurological signs or symptoms such as numbness, tingling, weakness, cramping, fatiguing, or bowel or bladder dysfunction that's associated with their back pain, those are significant neurological signs that would require further evaluation. Things patients can do at home to help their own back pain are rest, anti-inflammatories that are over the counter, avoiding physical activity or strenuous physical activity, especially avoiding activities such as BLT, which stands for bending, lifting, and twisting. Otherwise, home exercises and stretches that they can find from YouTube or Google are quite sufficient in helping mitigate their back pain at home. Exercise and physical therapy can definitely be used to prevent back pain. Exercise strengthens the muscles around the spine, and stretches also help loosen the muscles that are spasming from the exercises or just from wear and tear, and help reduce pain from the spine. Additionally, the stretches improve mobility of the spine and can help decompress the spine, which helps remove pain that's coming from the spine. Surgery is considered for back pain only after patients fail conservative therapy. What that means is they've tried medications, injections, physical therapy, various types of physical therapy, and they still have functional limiting back pain, meaning that they're unable to go about their lives or work with the amount of back pain that they have. The other reason is if patients have neurological deficits, in which case we tend to not wait as long before offering surgery in order to prevent permanent neurological dysfunction or neurological problems. If you or someone you know is experiencing severe or prolonged low back pain, especially if it's associated with any neurological signs or symptoms such as numbness, tingling, burning, or bowel bladder dysfunction, I would urge you or them to contact Advanced Neurosurgery Associates at Northside Hospital for a proper evaluation.